get a lot of questions regarding breastfeeding. Some of the questions just regard the logistics. When should I breastfeed? How often? Just what can I expect? The ideal time for the first breastfeed is as soon as possible after your baby is born. Ideally, you'll be in a hospital situation where your baby will have immediate skin-to-skin contact with you, and that really helps to promote that initial that initial time at breast. Breastfeeding works best when you catch the early signs of hunger, which include your baby having an increased activity level, in addition to some mouthing or rooting activities. Crying is a later sign of hunger. If you wait until your baby cries to try to get them to latch, it's a little bit less likely to be easy or successful. So you want to try to catch those cues early whenever you can. In the first month especially, babies will nurse frequently. A lot of moms worry that they're not making enough breast milk because their babies are hungry every hour to 2 hours, but that's really very normal. Breast milk production very much works on a supply and demand principle, so the more demand there is, the more your body will supply. The majority of breastfed babies in the first month of life will feed approximately 8 to 12 times a day, so that's every 2 to 3 hours. Each feed can last up to 40 minutes, so a lot of moms feel like this is all that I'm doing, and early on it really does seem that way. It's very normal to feel overwhelmed by the demands that puts on your body and the lack of sleep that often goes along with it. But again, rest assured that it's normal. If you stick with it, it does reduce in frequency after about a month, and it does get easier. Another question that we get very frequently is, how do I know that my baby's getting enough breast milk? Almost all women make an adequate amount of breast milk, so it's very unlikely that you're not making enough for your baby. And there are some very concrete ways to tell that your baby is definitely getting enough. One way is that a lot of women will notice their breasts are a little bit more full before a feed, and then they feel softer or more supple after a feed, after your baby has emptied the milk. Another important sign is that your baby is satisfied. Your baby seems happy, content, satisfied after nursing. Some babies get very efficient and will empty a breast in 5 to 10 minutes, and as long as your baby's satisfied, that's okay. That means that they have gotten enough. It's also important to look at frequency of urine and of bowel movements. In the first few days, babies really would only urinate a few times a day. By day 5, you should see 4 to 6 wet diapers a day. And in the first month or so, you should see at least 3 stools per day. A lot of parents worry about what the stools look like. They're afraid that it's diarrhea, but normal breast milk poop is very loose, is very watery. There's not much substance to it. A lot of times it's yellow. There's little flecks to it that look like seeds. People sometimes describe it as looking a little bit like Dijon mustard. The color is going to vary quite a bit, and unless it's red or dark and tarry, it's all very normal. Another important way to know that your baby's getting enough that your pediatrician will help you with is how your baby's growing. All babies lose weight initially, and it's common to have a 5 to 10% weight loss immediately after birth. Your baby should have regained the birth weight by about 2 weeks of age, and then following that, in the first month, we expect to see an average of about 1 ounce a day in weight gain. So if your baby is wetting well, stooling well, and growing appropriately, you're definitely making enough breast milk. A lot of parents wonder how much should they be making, how much should their baby be taking. In the first month or so, a breastfed baby will average about 2.5 to 3 ounces about every 2 to 3 hours. So a lot of times like 20 to 24 ounces a day is typical. After that, it goes up a little bit to 26 to 28 ounces after the first month. Remember that all of these numbers are really guidelines. Every baby's different. So even if you had one experience with one child, future children may be a very different experience in terms of breastfeeding. If you have any specific questions relating to how feeding is going, if your baby is getting enough, your pediatrician is a great resource. They can plug you into community services and help to reassure you that things are going well, or to offer assistance if you may need a little bit of help. So remember that breastfeeding is really one of the best ways that you can start your journey for your baby, and your pediatrician is a great resource for resources to make this journey successful. Thank you, and I'm Dr. Cheryl Kemmer from Warrenton Pediatrics.